just got done with the foils. Unfortunately, I had to redo this video because my mannequin fell off. So when I normally do the retouch, I'll do it in the back left quadrant back here. However, there's already cholesterol in that area, so I'm going to demonstrate in this quadrant, the right quadrant for you guys. So continuing on with what we're doing next is the stimulated retouch. So for the stimulated retouch, you're using hair color, which is going to be cholesterol that is red. So I'm going to talk to you about what you're going to be evaluated on, and then I'm going to read it, do the prompter, and then I'm going to just walk you through it with some tips that I have. You'll be evaluated on 7 things during this portion. The first one is going to be, are your hair color retouch supplies in English? Implements and supplies are visibly clean. So you subsection the hair. Applies the hair color product properly. Final result of the retouch application. So they're looking to make sure that you only stay 1 inch, or applying product only 1 inch from the root. That you outline, that you take 1/4 of an inch subsection as you're doing it, and you're staying neat. They don't want to see it all over the mannequin's head. Now I had students, or I've seen students that apply it that way and they pass, yes. However, don't slap it on the head. Just making sure it's overall neat. That you maintain drape throughout the entire section, and items be disinfected, soiled linens and trash are put in their proper area. So I'm going to go ahead and read off what the prompter is going to say, and then I'm going to walk you through this. Your prompter at the front will say, you'll perform a hair color retouch application. You'll apply hair color product on 1 section of the back of the head. So it does have to be in the back of the head. So pick a section and stick with it. Your client has 1 inch of new growth. You'll be expected to follow all client safety, protection, and infection control procedures. You have 10 minutes to complete this section. You'll be informed when you have 5 minutes remaining. Step back to indicate you are finished. She'll repeat that, and then once she's repeated it, she'll say, you may begin. So once she says that, you can grab your gloves. Put your gloves on. Now, I have my students always use the protective cream. Just it kind of embeds it in their brain for when they take the theory. So I'm just going to apply some protective cream around the hairline. Now, normally on the other side, the other quadrant, I do not have this Band-Aid there. Do you have to do the protective cream? Not necessarily. However, you do have to for a relaxer. So it's just more of a CYA. So I always take the top off with the cholesterol facing the ceiling. Should have enough. And go ahead and emulsify it, kind of work it through the bowl real good. It's going to help your cholesterol be easier for you to use today. So I'm not going to do the whole quadrant, just enough for you guys to see. Before you get started, if you are somebody that's really shaky and messy, and if you have paper towels, you can take 2 paper towels and you can clip them. Make sure that you're not having the paper towel in the client's face though. I did notice when I was rewatching the other video, she had a hair in her face while I was doing the foils. So make sure you guys watch for things like that. Anything I do wrong in these videos, definitely make a note of it. Learn from my mistakes. And then you can put another one on this side as well if you want. So the first thing I'm going to have you guys do is outline the quadrant. Now, I train my students to start from the top rather than the bottom. If you start from the bottom, you're going to take a section, you're going to clip it up, apply. Put this down, take your comb, unclip. It's just a lot of work. And we only have 10 minutes, and you don't want to be stressed out. So you're going to go ahead and apply just 1 inch of new growth. You don't want to get it on her actual scalp. You mainly want to focus on just putting it on the hair. Don't be afraid of the product. A lot of my students at this time, when they start using cholesterol and practicing, they put very little on. Don't be afraid, but don't put too much on either. Find that happy medium. Make sure you control your wispies. Alright, so now that I've outlined the quadrant, I'm going to go in with my subsections. You can use the back of your brush, or you can use the back of your tail comb, whatever you are confident in doing. And you want to take about 1/4 of an inch subsection. You're going to make sure that you do the top and the bottom of it. So let's say top and bottom. I'm going to do another one, top and bottom. Now when you lay them down, or you lay this top slice down, you have a couple options. You can use good tension when you lay it down and kind of let it fold at the bend right above the cholesterol. You can place your comb underneath and fold over it, and that'll keep a nice indentation for you. But your comb is now contaminated on this side, so if you do that, you will want to have a paper towel or an extra towel to clean that off with. It's up to you. So I'm going to go ahead and do a little more of this section. If you forget to outline in the beginning, outline at the end, just as long as you outline. Now I suggest that you outline first, because when we lay our subsections back down, you're going to be able to still see each of those subsections. But it does take a little practice to do it that way. So make sure you have enough in your bowl, for sure. And you want to watch your cholesterol at all times. If you drop a glop of it, make sure that you pick it up immediately and clean up. I'll take my next one. So as I do these next two, just a few more reminders. Make sure you outline the quadrant. When you're taking your subsections, they need to be 1/4 of an inch, and they need to be as neat as they possibly can. And you're going to continue down this entire back quadrant. Now, if you have never used cholesterol, I highly suggest to practice with it. For those of you out there that don't know where to buy it, you can get it from Sally's Beauty Supply. Walmart has even had it. Any beauty store will have it. And a little bit will go a long way. Alright, so I'm going to stop right here in the quadrant. You guys can continue on now. At State Board, you have to do this entire back one, but I don't have time for all that. So when you're bringing your sections down, so we're going to pretend that I have completely put new growth, new growth, new growth, new growth, new growth, and I've already pulled this down. So when you're pulling it down, make sure that you want to keep, as you pull it, that you keep your subsections. So you should still be able to see them. I know I can see them on this side. I'll bring it up really close towards the end. This way, when your examiner is walking by, she looks at it and she automatically sees that they are still 1/4 of an inch. So some of them have connected, but you can tell that that's about 1/4 of an inch. And that's where I did it yesterday, before my mannequin decided she wanted to fall. So when you are doing your retouch, make sure that you think in terms of that. Alright, so I'm going to put my mannequin, hopefully successfully, back on. I highly suggest you guys bring a squeegee. I have had an interesting time with this mannequin, and you can tell she's already trying to fall off this table. Alright, I'm going to position her a little differently just so you can watch closely on the Virgin Relaxer part. So we have completely done the back, and we want to clean up. So our 10 minutes is still going. I'm going to take my color brush, put it in items to be disinfected. I'm going to take the top of my color, cholesterol. I'm going to put the top on, and I'm going to put that in the trash can. I'm going to look around any comb, that I use, I'm going to go ahead and put that in items to be disinfected. And nothing else I want to throw away at this moment, so I'm going to take my gloves off. My gloves go in the trash. And then I will sanitize. And I will say this, sanitizing after you take your gloves off kind of helps a little bit because my hands sweat in the gloves and the alcohol from the hand sanitizer dries them out before I have to put them on again. But just practice with it and find out. So when you're done, you're going to step back. Your examiner is going to come by and she's going to check you off on that back quadrant. So let me make sure all my notes, yep. That's pretty much it for the retouch. However, you are doing the entire back. I did not do that today. And I think we've used 10 minutes with me talking a lot. All right, so next thing that we're going to get into is the virgin hair relaxer application. So you are going to be checked off on 6 things for this. Your virgin hair relaxer supplies are labeled in English. Implement supplies are visibly clean. You subsection the hair for a relaxer application. You apply the stimulated relaxer product. You maintain drape throughout the section. And items to be disinfected, soil linens, and trash are disposed of in the correct manner. I usually do it in the front, one of the front sections. I did the other side yesterday, but that video got all messed up, unfortunately. So I'm going to demo it in the front again today. All right, so I'm going to read what your prompter is going to read, and then we'll move on. You will perform a virgin hair relaxer application. You apply the stimulated relaxer product in a single subsection of the hair. You'll be expected to follow all client protection, safety, and infection control procedures. You will be instructed individually by the examiner to demonstrate the virgin hair relaxer application. This is an untimed section. Do not begin to demonstrate the virgin hair relaxer application until instructedly to do so, and then she'll repeat it. So basically what that means is after she talks, your examiner, the person at the table, is going to come up to you and say, or tell you, please demonstrate virgin hair relaxer application. It's very wordy. So I'm going to go ahead and take this paper towel down. I should have already taken it down after the retouch, but I forgot. Summer's already kicked in, you guys. So once the prompter's already taught, the examiner is going to come. So we'll pretend the examiner just said, please demonstrate virgin hair relaxer application with stimulated product. So the first thing I'm going to do is grab my gloves and put my gloves on. And then the next thing I'm going to do is I'm going to create that subsection. So I'm going to take a little bit of hair, probably from the parietal ridge up, to where it'll want to just hang nicely for me. And I'm going to clip that out of the way. Now another thing you can do with your paper towel just to stay neat, you can take your subsection that you want to use, go ahead and grab that out. You can take a piece of paper towel and place it underneath and give it a clip. Hold on, she's about to fall. Alright, so now that's in steel. So the next thing I'm going to do is I'm going to put the protective cream around. So for your protective cream, you're actually going around this entire subsection. So I'm going to place around the entire subsection. And make sure you get that hairline too right there where the subsection is. I'm going to place my protective cream down. I'm going to open my relaxer. This is just regular cholesterol. I did not put any food coloring in it. I'm just kind of emulsifying it a little bit. I need just enough on my brush to apply just what I need. So when you're doing a virgin, we're starting 1/2 inch from the root area. Go ahead and get you a nice little line right there. And then you're going to drag the product down. You can add a little more product if you don't have enough on your brush. But make sure you guys are moving along in the same direction as the cuticle this entire time. Go ahead and lift it up. As you lift it up, be careful not to put the cholesterol from the strand into that area. Make sure you get enough cholesterol on there. Once the mid strand is done, I'm going to take my tail comb and I'm going to use the back of my tail comb. You never put the teeth of your tail comb into the relaxer ever, ever, ever. And we're going to smooth it. Now, we're smoothing in the direction of the cuticle. A lot of students will go up and you're just fraying and screwing that cuticle all up. So once again, we're going in the direction, right here in the mid-strand, in the direction, in the mid-strand. Now you have a little bit of your stimulated relaxer on your comb. You're going to use this product and you're going to come right up to the root, not touching the scalp. Remember, this has a pH of 13, not going to the scalp. Just right there at the root of the hair, not on the scalp of the head. And I'm going to do the same thing on the other side. And then we'll go ahead and just smooth the ends. Smooth the ends as best as I can. Lay it down. Items to be disinfected for my comb. Items to be disinfected for my relaxer. Relaxer goes in the trash. And if your relaxer bust after you put it in the trash, go ahead and take your one glove off and grab your protective cream. Put that in the trash and then take your other glove off. So if your cholesterol busts in the bag too, just improvise, you guys. Go ahead at this moment and see if there's anything on the table that you can take off if you have the time. So I'm going to go ahead and take out some clips and my comb, which will go in items to be disinfected, and the extra glove goes into my trash can. I look around, I'm happy with it, and then I sanitize. And you step back. So what mainly is going to happen during this time, your examiner is going to say, you two start, you two start, you two start, and everybody will start being in a ripple. So if you're the last one and you don't have all that time to clean up everything from the relaxer portion at least, because you have a 2-minute transition after our next thing, which is the most stressful transition throughout this process. All right, so the next thing, last but not least of your client too, is a blood exposure procedure. So these are the following things that they're checking. 1, blood exposure supplies are labeled in English. 2, you remove materials from the first aid kit. 3, supplies and materials are visibly clean. 4, cleans injured area with antiseptic. 5, covers with dressing that is absorbent and secure. 6, candidate wears gloves or finger guard. 7, dispose of all contaminated supplies. 8, items to be disinfected, soiled linens, trash are disposed of in the proper manner. All right, so I don't know why I keep putting that over there. Those are things that you're going to be checked on. I'm going to go through the steps. These are the steps that are found in the Milady's book, step by step. Once again, I just follow the book. You can change it how you want. I will talk as I go through it so you can get all of the steps. So your prompter at the top is going to say, you will demonstrate the blood exposure procedure. You will imagine the following scenario. During a service, you have sustained a minor cut on your index finger. The injury is such that you can continue the service. Your work area and client has not been contaminated. You are expected to demonstrate the proper procedure for blood exposure. You are expected to follow all client protection, safety, and infection control procedures. You have 10 minutes to complete this section. You'll be informed when you have 5 minutes remaining. Step back to indicate you have finished. She'll say that one more time, and then she'll say you may begin. So let's say you may begin. Oh no, it failed. I knew something fell. So we're just learning a lot. Sorry about all the stuff going on, you guys. It is not my day in these videos. Everything keeps going wrong. But good note, if anything falls off your station, immediately go pick it up and then sanitize your hands. So I just picked this up, right? So I'm gonna put this down and I'm gonna sanitize my hands. And then we're gonna get back to reality. All right, so our proctor just did womp womp, and she said, you may begin. So I have a cut on my index finger. So the first thing I need to do is kind of just control the blood. So I'm gonna just dump everything out, and I'm gonna grab my first glove. You should have 3 in here. My first glove immediately goes on my injured hand, and what this glove is doing is captured any of the blood that is spewing out at this moment. And then now that my blood has been controlled, I'm going to put a clean glove on the other hand, so now I can protect this hand while working on this hand. So I'm gonna take this off. I'm gonna immediately put this back into one of the plastic bags. Do not put it on your station. You'll contaminate your station. And then my next step is to stop the bleeding. So you can use a cotton ball, you can use a gauze. Just hold it there for about 3 seconds. Like I said in the other videos, give your examiner a beautiful smile, and then you can put it inside the bag. Make sure you're not touching anything with this hand though. And then we have to clean the area. So we're gonna take our antiseptic wipe, we're gonna throw our trash in that bag, and then we're gonna clean. Now cleaning, go ahead and give it a little bit of a circle motion. So now she sees you're not holding it, you're actually cleaning it. So make sure you smile at your examiners. All right, so after I have cleaned it, I need to bandage it. So I'm gonna put a Band-Aid on. Once again, Band-Aids and gloves are not friends. So practice with this. Make sure it goes in the bag. All right, so go ahead and prep your Band-Aid. And I'm gonna place it right over the index finger. And then I'm gonna put my trash in the bag. I have an extra cotton ball, that's trash, I'll put that in the bag. And I'm gonna put a glove over my finger, because if you've cut yourself in the salon, sometimes one Band-Aid is not going to stop all the blood, and you definitely need a glove. So once a glove is on my injured hand with the Band-Aid, I will then take off the glove on the other hand. I will place it into the bag. I will close the bag tightly, fold it. I will place it into another bag. This is called double bagging. You do not have to have a hazard sign on this. They don't require it, but you do need a double bag. And then this goes into your trash can. You can sanitize or you can step back. So in the same motion that we were going, you can sanitize and then step back. So you are left at the end of client 2 with just about nothing on your table and a glove and a Band-Aid on your hand. Now, can you take this off? Yeah, you definitely can take this off. You'll do it in your next transition. Do not take this glove off while client 2 is still going on. So I'm not gonna do the full demo